Good morning. I'm here today with Amy LaPointe from Great Lakes Caring. How are you today?
Good. I'm good, thanks.
Good. Thanks for being with us. You know, and as I look at all of the services that Great Lakes Caring provides, I mean, they really start from, you know, when a loved one might be sick and needs in-home care all the way to even after that loved one may have passed. And so knowing that you provide all those services today, I'd really like to focus on the special hospice care that Great Lakes Caring provides.
Okay.
And I was hoping maybe you could just tell us a little bit about what hospice really is.
Okay. Well, hospice care is basically another word for comfort care, we say. It's when somebody has their disease or and has gotten to the point where they have been told by their physician that they have 6 months or less. They have a terminal illness and they've been told that they have 6 months or less to live. So basically choosing more the comfort care route versus the aggressive curative care route is when people choose hospice. And so hospice is really, we say it's a philosophy of care versus it's not particularly a place, but it's a philosophy of care, and hospice can be done where anybody calls their home. So it can be a hospital, a facility, and a assisted living. It can also be done, within somebody's home or their children's home. So wherever somebody calls their home, and it's a whole team of people coming in to care for the person who's chosen hospice. For comfort care, we have a nurse that directs the plan of care, a social worker, certified nurse aide. We also have chaplain and volunteers, and then we also have therapies like music therapy and massage therapy. So some additional therapies that we can help with.
And so, you're telling me about all these things and these cares. It's got to be expensive. How does the family pay for all of that?
Yeah. Well, hospice is a Medicare benefit. It's part of Medicare, and it's under the Medicare A benefit. So the best way to kind of describe that to people when I meet with them for the first time is to let them know that it's hospice services are covered under Medicare A. So it's something that somebody was maybe paid into all these years, and it's a benefit. If somebody goes into the hospital or if they're, doing rehab, that's also a Medicare A benefit. But hospice is part of the Medicare A benefit, so everything related to a diagnosis is covered. So all of the services by the team that are coming in, any equipment that would be needed, such as oxygen, hospital bed, wheelchair, and then any medications related to the diagnosis as well would be covered. So all of that is covered under Medicare, and then also some private insurances can cover that as well. But primarily Medicare is the primary pay source.
Okay, so it really helps anyone who needs that
Yes.
services, and they don't have to worry about all those added expenses.
Yes.
Especially during a time of great tragedy and pain.
Yes, definitely.